I'm Dr. Benton Emblom, an orthopedic surgeon here at Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama. I specialize in orthopedic sports medicine and arthroscopy, also have additional training in arthroscopic and mini open management of non-arthritic hip disorders. I grew up in Dothan, Alabama, which is the southeast corner of Alabama. I played football, I played basketball, I played soccer, I water skied, and any other sport that we could play to have fun. When I graduated from high school in Dothan, I went to the University of Alabama, pursued a major in mathematics and chemistry. When I graduated there, I matriculated at the University of Alabama School of Medicine here in Birmingham, completed a 4-year medical school degree, and then pursued an orthopedic surgery residency at UAB as well. Although I never left the state, I moved down the street and completed a 1-year fellowship in orthopedics and sports medicine with Dr. Andrews. The ASMI limb of our fellowship was the research limb, and the Andrews Sports Medicine was the clinical side. So that year consisted of an intense year of surgical training, on the field experience in terms of football coverage and other sport event coverages, as well as research. After I finished my fellowship with Dr. Andrews, I completed a mini fellowship that consisted of 4 months of additional training in hip arthroscopy up in Nashville, Dr. Thomas Byrd. Most patients that have non-arthritic hip disorders that do require hip arthroscopy are relatively young. It's not an individual that has degenerative hip disease such as hip arthritis or avascular necrosis. It's usually a patient like we see with their knees and shoulders. They have a soft tissue injury such as a cartilage or a labrum. They have hip impingement, for example, that leads to labral tears, and they have pain with activity. Those types of patients refuse to lose and basically seek treatment in order to maintain an active and healthy lifestyle. I tend to consider myself as the complete sports medicine specialist. I take care of shoulder injuries, elbow injuries, hip injuries, and knee injuries. In the shoulder, the typical type of procedure and treatment that I would offer would be rotator cuff repair, arthroscopically of course, labral repair for instability, AC joint repair that we can now do arthroscopically, which is a relatively new technique. In the elbow, tendon injuries such as a biceps tendon or a triceps tendon tear, ulnar collateral ligament reconstruction in overhead athletes. And the hip, obviously hip impingement, which can subsequently lead to labral tears, is done arthroscopically now. Sports hernia repair, which is a very popular topic in explosive sports such as football, hockey, tennis, etc. I treat here at Andrews Sports Medicine. That's done through a mini open incision. It can't be done arthroscopically. In the knee, ACL reconstruction, patellofemoral stabilization surgery, routine meniscus surgery, and total knee replacement in our patients that we take care of in their kind of middle-aged part of their life that go on to develop arthritis down the road. We're still here for them too. I currently take care of Hoover High School every Friday night during football season and as needed through other seasons of the year with other sports. I also take care of Samford University and the University of Alabama. I married my high school sweetheart, Anna Armstrong, currently Anna Armstrong Emblom from Headland, Alabama. And then we got married in medical school and had 2 sets of twins. We have fraternal girls, Ella and Camille, and boys that are identical, Lawton and Haston. I really enjoy taking my family and my children in particular to sporting events because that allows me quality time with them. They have interests in sports, I have interests in sports, and I get to work and they get to play. At Andrews Sports Medicine, we take a lot of pride in delivering the highest level of care. We treat every patient very professionally and respectfully, regardless of what sport they play, what occupation they have, what socioeconomic background they're from. We try to be honest and open and give them realistic expectations and treat everybody the same from the minute they walk in the door through the process of surgery and in their rehab.